Hi, my name is Siobhan and I'm here at KinesiologyZone. Today I want to talk to you about back pain. So many people suffer from back pain, and often the advice is take a painkiller and see if it goes away, or bed rest, or time. And what I want to do is to kind of give you an idea about a principle that we use in kinesiology and systematic kinesiology. It's called the guy rope principle, to help understand what's going on with back pain. And you know, sometimes it's easy and sometimes a bit more complicated, but this principle helps to understand often that we're looking in the wrong place for back pain. So often our clients will be directed to where it's tight, where the muscle is very, very tight. And with this guy rope principle, I have this little stick here, and I have these elastic bands to kind of demonstrate how muscles might be holding the spine in place. So this imaginary spine here, and these two muscles represented throughout the body. So if we're in balance, then the spine is nice and straight. And for whatever reason, whether it's a trauma to direct to a muscle, not using the muscle very often, lots of different reasons which I'll go into, is let's pretend that this muscle here isn't doing the job. Okay, my lovely cheap demo here. So if these are balanced, if this muscle for some reason starts to weaken, it is going to mean that it's not supporting that the spine properly. And what happens is that this muscle here is having to do the job of the other muscle, or it bunches up quite naturally. We see this sometimes with shoulder problems. Sometimes a shoulder will rise up, one shoulder will be higher than the other, and that could be due to a muscle in the back that holds this shoulder down is weak. And so you can start to look, if you look at yourself in the mirror, sometimes you'll see that there's different heights in your shoulder, for an example. So with our guy rope principle, I want to find out, well, why is this muscle not working properly? And you know, so sometimes people will say, oh, well, should I take this supplement, or should I do this exercise? Will that help strengthen this muscle? There's lots and lots of ways in which you can strengthen a muscle. We use a series of reflexes on the body. We look at nutrition. We look at emotional reasons. So we're very much looking at the mental, chemical, physical, and energetic reasons that a muscle might not be functioning properly. And often clients are going to always draw us to where there's tightness, but that really is just where the pain has ended up. And so when we then test our individual muscles, okay, when we test those muscles, we can see, well, is it weak? And so part of our testing is to identify where is not working properly, find out what some of the underlying causes are, and then balance the body. So kinesiology is well known for being able to identify things like food sensitivities and emotional stresses and things like that. But when you put it all together, when you work with the energy and the structure and these reflexes that help the lymphatic system, help the blood supply to that muscle, we look at food sensitivities to see, is there something maybe that needs to be avoided that might actually be having an effect on the body? And then what happens is then that this muscle then takes the strain, does the work, and the other muscle, which was tight, can then relax a little bit more. It can function properly. It's not trying to do two muscles or three muscles job. And so when the person is more balanced, then the spine is more stable, the muscles are working properly, and so then you're prone to less injury. So often people who are, doing exercise, sometimes they'll be more prone to injury when their body is out of balance. But usually people think it's a structural problem. They need to go to the physiotherapist, they need to take a painkiller, they need to bed rest, whatever it is. And sometimes those are right for you. But you want to really deal with the underlying causes. What's happening every day? Is there a food sensitivity? Is there an emotional stress or anxiety that the person is suffering from that is actually having an effect on the body? So I hope that helps. When you're next thinking about getting a tune-up, or maybe you work with clients who have back pain, but you are working in one particular modality, maybe in the emotional side or the physical side, and you're looking for ways in which to give a more holistic or whole person approach. So check out our courses on KinesiologyZone.com. I look forward to seeing you soon.